Only mode.
Hello everyone. Thank you very much for joining us for what will surely be a wonderful presentation today. My name is Eva Noble and I work for the CPC Learning Network Secretariat in New York. The CPC Learning Network convenes academics, policymakers, and practitioners to promote innovative research, nurture communities of learning, and build the next generation of researchers and advocates for children and families worldwide. The CPC Learning Network hosts ongoing webinars throughout the year to highlight innovative research in the field of child protection and to discuss relevant issues through these webinars. Today we will be hearing about an enumeration study undertaken by Retrack, Chisomo Children's Club, and the Government of Malawi to learn about children on the streets in Lilongwe and Blantyre, Malawi, using capture-recapture methodology. Currently, very little evidence exists about the numbers of children living and working on the streets globally, undermining efforts to ensure that they are receiving adequate and appropriate care. Today, we will be hearing from three wonderful presenters. First, we will hear from Joanna Wakia, the Monitoring and Research Advisor at Retrack, who will present the methods and findings of this study. Joanna has been involved in the monitoring, evaluation, and research within street child sector for about 10 years, building on over 20 years of Retrack's experience working with children on the streets and their families. Joanna has coordinated the documentation of Retrack's model and standard operating procedures and developed methods to track changes in the lives of children and their families. She's the co-author of the report Evaluating Outcomes, demonstrating the improvements in children's well-being during their reintegration journey, and is currently looking into street outreach and independent living, two other key interventions for children on the streets. Alongside David Whitford, she's been exploring methods for enumerating children on the streets and led Retrack's pilot enumeration in Malawi, which we will hear about. Mr. Charles Gwengwe is the Executive Director at Chisomo Children's Club, and he'll be then presenting the recommendations that came from this research. Mr. Charles Gwengwe is a well-known child welfare specialist and has over 8 years' experience providing assessments, social services, counseling, and case management to children and families. He has many years of experience working in the NGO sector, focusing on work around orphans and vulnerable children in Malawi, and is a member of the National Technical Working Group on Children and Youth in Malawi. Last, we will hear from Mr. McKnight Kalanda, who is the Director of Child Affairs in the Malawi Ministry of Gender, Children, Disability, and Social Welfare, who will be commenting on what these findings from the research mean from the perspective of the government of Malawi and what next steps are to be taken. After our three presenters, we will have a question and answer session. You will be able to submit questions throughout the presentations, and I will share them with the speakers at the end. There's a questions box on the GoToWebinar pane. Please submit your questions there. Please also let me know if you have any issues hearing or seeing the presentation using the question box feature so we can try to make adjustments on our end. This webinar is being recorded and it will be shared on the CPC Learning Network website within 24 hours of the webinar. This website is www.cpcnetwork.org and the webinar will be posted under the section News and Events. With that, I will turn it over to Joanna to kick this off. Thank you again.
Great, thank you very much, Eva. It's really nice to be here and to be talking to everybody about some of Retrack's work. Thank you for joining us today. So as Eva said, we're going to talk today a little bit about the enumeration exercise that Retrack undertook in collaboration with Chisomo's Children's Club and the Government of Malawi, trying to find out a bit more about children on the streets in Lilongwe and Blantyre. We were working in partnership with lots of the NGOs on the ground, as well as the Government of Malawi, very kindly funded by the Human Dignity Foundation. We were very pleased to be able to work with David Whitford, who is a former US Census Bureau statistician and kindly donated a lot of his time to help us with this. As you've heard, Retrack is an international NGO working across Eastern Africa, helping to ensure that no children are forced to live on the streets. We reach out to children on the streets and help them to find alternatives, as well as supporting their families and other vulnerable communities to care for their children to help them remain at home. And you'll hear later from Charles, who's the director of Chisomo Children's Club, which is a Malawian NGO also working with families and children who have been separated from their families. So I'm going to spend a little bit of time talking about the methodology and the background of the study. We're very keen to talk about the methodologies because this is an area that needs to be highlighted and for further discussion to be had. And then I'm going to look at some of the findings from this study in Malawi. So as you've heard, there's a global lack of evidence around children on the streets, which is available to inform policy and practice, and especially in terms of the numbers of children who are on the streets. This is beginning to change with more local studies emerging. However, the statistic of 100 million children on the streets is frequently cited and has been since the late 1980s, and yet there's very little evidence to back up that number. We've seen that large guesstimates of street populations in the past, and the talk of rapidly growing populations has brought attention to the issues of children on the streets, but not always in ways that are positive. Governments have been persuaded to act, but sometimes they've responded with large roundups of children into detention centres, leading to children being pushed further to the margins and becoming more invisible. Children's situations are no better understood, and so they can't be responded to appropriately. But counting children and understanding the size of populations on the streets is very complex. Lots of hurdles exist to be overcome if we are to understand and have accurate estimates of children on the streets. Definitions of who a street child is a hotly contested issue. There are lots of different definitions that exist. People like to talk about the children's connections to the streets as well as their connections to work and family. But it's important that whatever definition is decided upon for an enumeration exercise is actionable, that it's easy for enumerators to say this is or isn't a child I should be including. There's also a lot of debate around suitable methods to use, not just with children on the streets, but with any hard-to-reach group that isn't going to be easily counted through a traditional survey or census. Populations that are mobile or hidden away or that have limited access to services are hard to include. Children on the streets are very often hidden away, and they're often involved in illegal activities, or they're afraid of the authorities, and they are not easily found or encouraged to participate in surveys. Along a similar line, it's hard to gain children's trust and to find out where they are unless you have a good understanding of what is going on at the street level. It's important that any enumeration exercise involves locally knowledgeable and skilled actors who understand the culture and the location of children on the streets, so that it's possible to find them and to build trust with them in order to be able to get accurate information from them to inform your survey or study. And we're all dogged by a limited resources, not having enough money to do the things that we would like, especially around this area. People are demanding more and more evidence, but not necessarily putting forward resources to fund that. And it can be a hard choice to face if you have a pot of money as to whether that's going to go to provide direct services or whether it's going to help you to undertake a study to understand more about these children's situations. So let me tell you a bit more about Malawi and why we decided to do this work there. Retrack began working with Chisomo Children's Club in Malawi back in 2013, and it was clear that there was no reliable estimate of the number of children on the streets. There had been several qualitative studies undertaken that provided a really good understanding of the experiences of children on the streets and some understanding of the nature of the children who were there, but there was no attempt to estimate the numbers and to be able to break down that estimate into different categories. The government has just recently completed drafting a national strategy for children on the streets and highlighted within that the need to undertake studies to better understand the children's situations. So in the interests of finding out more about the children on the streets, Retrack teamed up with Chisomo and the other stakeholders on the ground to try and address this gap in the knowledge. Malawi also felt like a good place to pilot a methodology for the first time, given that Malawi has relatively small cities and very peaceful in nature, so it was easy to get around and to try something that was new to those of us involved. The goal of our study was to provide an estimate of the number of children on the streets in Blantyre and in Lilongwe, and we were trying to do this, as I say, to inform both the government's strategy and also the work that was going on directly with the children by the government and other NGOs. When we reviewed the national strategy and other literature that already existed and in consultation and ongoing conversations with stakeholders on the ground, it was decided that we would focus our study on both children who work on the streets and those who sleep and are living full-time on the streets. So our definition covered both of those groups, whether that was children being observed doing those activities or them reporting to us that they were doing those activities. We also had a lot of conversation about the age group that we would include within our study. In Malawi, a child is, by law, those under the age of 16. So we decided we would go up to that age limit that is set in Malawian law. And through negotiations and discussions with the various stakeholders, and particularly the government, we decided that we would go down and include those children of 7 years and up. But since we were going to be undertaking the interviews by trained and experienced staff, many of whom were social workers, we felt it was okay to be able to interview some of the younger children, as long as we had those professionals involved and that there was a clear way of referring children on for help if we needed to. Now, looking a bit more at the methodology, we use what's called the capture-recapture approach. We spent some time looking back at other enumeration studies, both of children on the streets and of other hard-to-reach groups, and looking for the successes and the struggles in past studies. What we found was that very few studies included measures of accuracy and reliability, and that a lot of the studies did not very clearly explain the methodologies that had been undertaken. So it was hard for us trying to decide on a methodology to be able to follow any of the examples that had gone before. And some, it appeared, had been quite poorly designed, and they hadn't had enough of an understanding of children's lives on the streets, and so that they were not going to have a great coverage of the children on the streets. So as I say, I'm going to spend a bit of time talking about this methodology because we're very keen that conversations continue around what might be the best way to try and get estimates of children on the streets. The capture-recapture methodology is originally used in biology to estimate numbers of animals or fish or insects or anything that's kind of hard to round up and have in one place. It's therefore also suitable for hard-to-reach groups where you can't do a complete census because of the nature of those groups' lives. This methodology has been used a few times already with children on the streets, mainly in Africa, but also in Brazil and recently in Lebanon as well. And I haven't been able to put the reference to that one. That's just come out this year. So it has been used a few times with some ups and downs within that, so lots of learning happening around how to do that successfully with children on the streets. The basis of this count, this methodology requires 2 counts, which are then compared and matched to see how much of an overlap there is between the 2 counts. The counts don't need to be complete censuses, but they do need to be independent from each other, and they need to cover the whole area where the population exists. When the 2 counts are compared, you look for the match or the overlap between the 2 groups, and that allows you to then inflate the initial count by the percentage that was missing. So the example on your screen, the second count revealed that there was a 10% that was missing from the initial count, and so it's possible then to inflate the initial count by 10% to give you an estimate of the entire population. We undertook our data collection in Lilongwe and Blantyre towards the end of last year, in collaboration, as I say, with NGOs and the government agencies on the ground. We had 50 staff volunteering to act as enumerators, and together with them and staff more broadly from these organisations, we identified the locations within each city where we knew children were known to congregate during the day and during the evenings and night times. in order to map out the locations where we would focus on for our count. Then the enumerators were divided up into groups of 5, so 2 pairs and a supervisor, and they were allocated to the different locations. We had 2 days of training, which focused on the nature of children's lives on the streets and our understanding of that, and how to interact and approach children on the streets, especially doing so with respect and in order to try and gain their trust, and not trying to kind of overcome the general prevalence of stigma against children on the streets, as well as looking at the interview tool that we were going to use, practicing that, and having various discussions around the practical side of it, which was definitely more complicated than we had anticipated. Looking at moving around and how we were going to gather all the information in. So as I say, in teams of 5, they went out and undertook 10-minute interviews with every child who they observed to be working, getting ready to sleep, or hanging out on the streets. In their teams, they were allocated to locations which they covered over 2 days, which became count 1, and then we moved all the teams around and they went to different locations for 2 days, and that was count 2. For me, one of the exciting things to see during the data collection period was the impact that participating as enumerators was having on the enumerators themselves. To start with, a lot of them were quite nervous about going out onto the streets, a little bit unsure about how it was all going to pan out, but very much by the end of it were very excited, and were very surprised by how welcoming the children were, how positive the children were on the streets, how they would run off and find their friends to come and get involved, how they were telling them about their desire to go back to school, and how much hope that they had for the future. It was very counter to the kind of general view of children on the streets. And as a result, a lot of the enumerators came away with a lot of motivation to do more work on the streets, to go out and do outreach and get to know the children on the streets and build relationships there in order to be able to bring new opportunities to them and help them to move forward. Once we had our data and it was entered into Excel, we began to process that, going through various quality checks to make sure that we had the data in the right format. We looked to remove duplicates of children from within each count. So there were some children who, in their enthusiasm, were interviewed multiple times during one count. And so we were removing the duplicate records from within that. And then we began to look at our definition and determine which of the children that we'd interviewed were eligible to be included within our count. And as I say, this was children within the age range of 7 to 15 years, and those who were who either told us they slept or worked on the streets, or who we observed to be sleeping and working on the streets. And once we had clearly defined our group of children to be included, we were then able to match the count 1 and count 2 for each city and determine our overall estimate of the street population. Let me talk a little bit about our limitations. Since this was a pilot, there was a lot of learning going on along the way. There were some things that we had to tweak as we went along. Sometimes largely it was to do with the understanding of the questions within the interview format that we were using. Some interesting things coming up, like asking children whose houses they were sleeping in, and whether we would include grandparents in the category of parents, or whether grandparents went in the category of other relatives. So just kind of tweaking some of the understanding of that as we went along. As I've said, also the logistics was quite complicated, so planning all of that out took a lot of energy along the way. Lots of things to learn for next time. Then for this methodology, the coverage is important, to make sure that every person within your population has an opportunity to be counted in one of the counts. So to that end, we made an effort to seek out girls on the streets, knowing the literature says girls are often less visible on the streets and appear to be fewer in number. We went to some lengths to ensure that we found the girls who were on the streets, and this included girls who were working in commercial sex work. And we worked alongside Theatre for a Change, who have a lot of experience in working with those girls in Lilongwe, and that did allow us to get a greater number of those girls included. We didn't have an equivalent partner to work with in Blantyre, and so we felt that we weren't as able to access the girls in Blantyre as we were in Lilongwe. There were noticeably fewer in Blantyre that we met with. There's also a possibility that we didn't cover all of the areas where the children were located. We covered all of them that we knew about, but there may have been children who hang out more on their own and in more hidden away areas that we weren't aware of, and so therefore they weren't included. But we're pretty confident that we got most of the areas and found most of the places, and the children were directing us where to go. And so if any child was kind of connected in with that general population, we think that they had a chance to be counted. So our coverage was reasonable. Seasonality, we did do this at one point in the year within a week, and so we've only seen what the population is like at that point in the year, and people in Malawi will say that they feel like there is a seasonal fluctuation within the street population. So it would be perhaps interesting to try and repeat this exercise or do something to compare with for a different time of year to see if there are influences throughout the year that change the street population. So now let me move on to looking at some of the results. So from our accounts, we have estimated the number of children who are living and working on the streets in Lilongwe to be 2,389, and in Blantyre to be 1,776. So roughly around the 2,000 mark, and this is largely what we were expecting. Quite a number of children engaged on the streets. If we look then into the characteristics of these children, what we've seen is that 1 in 5 are girls, and that over 50% are between ages of 10 and 13 years. So the graphs on your screen now compare the general population in Lilongwe with the street population for children aged 7 to 15. And obviously in the general population it's about 50-50 gender split and a fairly even coverage of each age group, whereas in the street population we've got far fewer younger children and far fewer girls. Then we looked a bit more into these children's relationship with home and with school. So over 80% of the children on the streets come from that city or the surrounding district. So most of them have family very nearby. Over 60% of them still live with their parents, and over 60% are on the streets every day, and close to 40% are attending school most days, with about 30% never attending school. So the kind of the overall picture of the children on the streets in Lilongwe and in Blantyre is that these children are largely still connected with their families. Most of them are going home to some sort of family at the end of the day. They're working on the streets during the daytime, often quite regularly every day, but also managing to combine their work on the streets with attending school, some every day, some more irregularly. And this is very similar to the previous more qualitative studies that went before our study, where they found a very similar gender split, very similar age structure, although it was all measured in slightly different ways, the age, so it's a little bit harder to compare. And also this sense of children going home to parents and to relatives at the end of the day. The majority of children are sleeping at home. We were interested in breaking down this overall group of children on the streets and looking at the two subsets within that of the children who live on the streets, the ones who are sleeping there, who are there all day, every day and night, and comparing that with the children who are working on the streets, who are just coming during the day and returning home at night. So as I've said, we found that About 10% of the children live on the street. So most children are going home to family, but 10% of them are living, they're sleeping on the streets. And when you take the overall estimate of about 2,000 children on the streets in each city, that means that there's only about 200 children who are living and sleeping on the streets, which is quite a small number. It's quite a manageable number in some ways. So that was quite exciting to realise that, you know, there's an opportunity to interact with those children and offer services dedicated to those children. It's not an overwhelmingly large number like it is in some African cities. So then the other group of children are the children who are working on the streets, and this is the majority. So 65% of children on the streets return to live with their parents, and another 15% are returning to live with other relatives. And as I say, these are mostly families who are around, very close by in these cities, a lot of them in the informal urban settlements. So when we compare these two groups, the children who live on the streets and the children who work on the streets, what we found was that the children who are living on the streets, the ones who are sleeping there, are more likely to be male. There are fewer girls living on the streets. They're more likely to have no contact with their family. So 30% in Lilongwe and over 50% in Blantyre have no contact with their family any longer. And the vast majority of them are not attending school. So these children are much more marginalised. They've fallen out of their family and community context. They're outside of the household. They're outside of the schools. They are much harder to get to, but they are a smaller proportion overall. Then the children who work on the streets, these ones are more likely to be female. So there's a greater proportion of girls who are working on the streets but returning home. They're very likely to be living with and seeing their family every day. And over 40% of them are still attending school every day, and another chunk are also attending school a bit more irregularly. So these children, although they are spending their days on the streets, often every day, they're still connected at home. They're still connected into school. We also were keen to look at the differences between the boys and the girls. We found, as I said, there's a small number of children on the streets are girls, only 1 in 5. The girls were less likely to be sleeping on the streets, but more likely to be living with their relatives. So a greater proportion of children, of girls on the streets were living with relatives as opposed to living with their parents. And we wonder whether there perhaps was a connection there with domestic work and girls being more likely to be sent off into domestic work. That's something we'd like to explore a bit more. And I know there's some work already going on in Malawi around that. Girls are more likely to stay in contact with their parents as well. So girls are fewer in number, but seem to be more connected into their families compared to the boys. That obviously then links into the education. The girls are more likely to remain in school. So if they're staying at home, they're staying connected with their families, they're more likely to have the opportunity to stay in school. That was much more pronounced in Blantyre, that pattern, than in Lilongwe, and I think there's a need perhaps to unpack a bit what's going on, because the engagement in education was different, but it was the one thing that was different between the two cities. But we saw in both cities that the boys were further behind in their education. They had fallen out and were less engaged and were several years behind in their education, even compared to the national average. And then we found that both boys and girls were reported to be involved in sex work, but we did find more girls involved in Lilongwe. And as I say, this was due to being able to work with Theatre for a Change, who understood the nature of those girls' work and where they were found, and were able to negotiate access to the children's working places through the Queen Mothers, who control the girls' work. And through having good relationships with them already, we were able to explain the study and what we wanted to do, and were given permission to interview the girls in their workplaces in the evenings. And because we didn't have that access, we weren't able to engage with the girls in the same way in Blantyre, and we suspect that there are equal numbers of girls involved in sex work in Blantyre, but that we didn't have access to them. But nonetheless, we were also keen to point out that there were a lot of boys involved. We found boys involved in sex work as well, and so it mustn't be assumed that that is a purely girls issue, and obviously both boys and girls need to be helped in that situation. So thinking about implications of this going forward, because we found that the overwhelming number of children on the streets are those who are still connected with their families, and that their families are nearby, they're in the cities, they're often in the informal settlements within and surrounding the cities. They're seeing them on a daily basis. Their parents may well be involved in sending them out to work. There's a need to focus on strengthening those families, going into the informal urban settlements and looking at how it's possible to address child labour within those settings. Looking at improving livelihoods, wider family strengthening initiatives, perhaps family therapy and parenting skills, but working with the families that are there in the cities. There's also a need to look at the greater community and to generate greater community awareness of the struggles of these children, perhaps through existing structures within the communities and through schools, to raise issues of child labour, to improve sensitisation, monitoring and referral of children involved in child labour and to improve their working conditions, to raise issues around child protection and parenting skills, to try and address gender norms, doing that at the community level so that we have these families but within supporting communities. We've also seen that there's a great variation between children's experiences on the streets. I've presented to you some ballpark figures, but there's a lot of variation underneath that. There's a lot of different situations that children are found in on the streets. And there's clearly two very different groups of children on the streets as well, those that are still connected at home and those that have lost all ties with home and community. So it's important to build more outreach activities to be able to understand what is going on for each individual child and to gain their trust and work alongside them to what they see as the next steps for their future. There's also a need around coordination of transition centres, because there is a relatively small number of children living on the streets and there are already provision of transition centres. It should be possible to coordinate the provision of services through those centres to be able to meet the needs of the children who are living on the streets, since they are a relatively small number, and to not be using transitional centres or other facilities to separate children from their families unnecessarily. And linking those transition centres to the provision of reintegration and alternative care options for children, and following that up with family strengthening support that probably parallel what is needed to strengthen families of those that are working on the streets. There'll be a lot of overlap there, and again, it's even the children living on the streets are coming from the informal urban settlements in and around the cities, so there's a lot of overlap there in a way to provide family strengthening in those communities. And then since we've seen that it was difficult to access the children in sex work, they are a much harder to reach group. It's important that there are specific interventions to reach those children and to make sure that it is for both boys and girls, even if there is a greater need amongst the girls, but to make sure that there is something specific for boys and girls and that there is a differentiation there in the services that might be needed for the two groups. So we feel that having found these results, that we have a bit better understanding of the size and the nature of the population on the streets in Lilongwe and Blantyre, and that as you can see here, that has a clear pointers for the implications that clear implications for policy and practice. And off the back of these findings, we together with the stakeholders in Malawi have come up with some recommendations for how we would like to go forward with this. And I'm going to hand over at this point to my colleagues in Malawi to take us through some of those recommendations. Thank you.
Thank you very much, Joe, and everybody else. And following this amazing study, the following recommendations were made, and it's quite interesting. We should be elaborating on these recommendations shortly. Me, alongside the Director of Child Affairs, we discovered that I think it was recommended that the focus really has to be on child labor and family strengthening in the urban settings, and that's quite very true, because reuniting the child will be the most desirable how to do any successful program. And despite the challenges that the families may have in terms of capabilities, but we feel like it's a real very important recommendation. In addition to focusing on child labor and strengthening in urban settings, it was recommended that we improve the outreach programs. While previously the government was so much into the sweeping, we call it sweeping exercise, or the roundups, and sometimes from what has been reviewed in the study, it meant rounding up children who had connection to the families, causing unnecessary separation, thought in terms of the way we plan our outreach programs. And the study also recommended the need to have services that are individualized. In other words, individualized attention and tailor-made services would be ideal to bring in more meaningful change or transformation in the lives of these children. And connectively, children involved in sex work and those affected by recommendation with NGOs and faith-based organizations, we should be able to really bring the change that we're looking for. And the other recommendation was to make sure that there is a national coordination and monitoring of all the activities which benefit children on the street. And this is really true. And I should think if we could in Malawi maximize the different strengths and that stakeholders have, which was reflected in the actual headcount exercise itself, we could probably register maximum impact. But added to that, we felt like lobbying and advocacy efforts would be ideal too. No wonder this came out as one of the recommendations, making sure that there is alignment of the national policy and legislation, and it all in the interest of making sure that we see the kids finally getting the best of the services. And I think the further recommendation was to make sure we do a further research and a discussion on the enumeration result methodologies and impact on policy and practice. And I think that is quite relevant. And I should invite the director himself to come in and share what he feels is the implication of the study and the recommendations made so far in this study. Thanks.
Thank you, Charles. I would like him to add on the implications for policy and practice basing on the results of the enumeration study. Over the last 2 or 3 or so years, some studies were being conducted looking at qualitative issues in terms of what is pushing the children to be on the streets. But what was missing was the magnitude of who is on the street and where are they coming from. So the results of the study has given us some ammunition to begin to look at what is the size of the problem that we have in terms of issues of children living and working on the streets, and also looking at the way the enumeration exercise was conducted. The 50 enumerators that participated, it created a platform for strengthening our coordination. And if we can pick it up from there, when now we go to the actual service provision, Charles earlier on mentioned the issues like ensuring that services are individualized. For that to happen, we really need to go full throttle using the case management approach, which as a country we have adopted, and we do realize that no one size would fit all the children that are found working or living on the streets. So we need to come up with individualized case plans for the children, but also above all, as we're looking at the individualized case plans, desist from the idea of separating the children from their families. They can be rehabilitated in the centers by way of transiting through the centers. But what we would like to see at the end of the day is the children being assisted. And for us as government, it's an eye-opener in terms of what urban poverty can do to families that are living mostly in the outskirts of our developing cities. So that's why as a recommendation, we are really saying we really need to focus on how do we strengthen the families from where these children are coming. And also in terms of the outreach, we really need to touch base with the other significant people that have an impact on the lives of these children from wherever they come. So these are some of the things that we are going to look at by way of implementation. And also suffice to say that just before the enumeration study was carried out, as government we had come up with a national strategy for dealing with issues of children living and working on the streets. And what we see being advocated in the national strategy and the recommendations that have been pushed forward through the study, they are in tandem. And what is required from government is to provide the leadership and in terms of policy guidance, but also provide the coordination role. So we really look forward to what do we do with those that are living on the streets. How do we ensure that they are rehabilitated, but finally reintegrated with their families? And if from the case management approach that we may employ, it is necessary that we strengthen their families economically, there is a program that we would like to to begin to look at. Currently, government is implementing the social cash transfer program, but that is targeted to the rural poor. But then looking at the results of the enumeration study, we also see that we could apply that to issues of children living and working on the streets as one vulnerable group of children that needs to be reached with this particular program. So these are some of the key issues which we see as Malawi moving forward in terms of using the results of the study. But also for further research, there are other issues that we still need to, not only in Blantyre and in urban areas, so that as we are looking at the provision of individualized services in all the areas where we have these children, we are working as a team. One of the critical issues that we see is the need to ensure that these children have access to education. So this is one area where our education stakeholders, through our outreach programs, would really have to come in more strongly now than before. Thank you very much for your attention.
Thanks. Over to you, Eva.
Fantastic. Thank you all so very much for a wonderful presentation.
Hello.
Thank you very much, all three of you, for a wonderful presentation, for everything spanning methodology, recommendations, bigger picture thoughts. That was fantastic. Thank you very much. I've received a few questions, and I also will ask any attendees to please submit further questions, the question box on the GoToWebinar pane. So the first question I have is a methodology question. So the first one is, given that you are working with street children, and especially children who are working or potentially living on the streets, these children often face challenges with law enforcement. So were there any challenges in terms of gaining consent or assent or participation in the data collection as a result of these challenging relationships?
Great, thank you. That's a good question. Even as Charles has already mentioned, there has been some use of roundups, and therefore the children have fear of the law enforcement on the streets in Malawi, as in many places. We work quite closely actually with the police and the judiciary to gain permission and to have their input and oversight into what we were doing. We went out with permission letters from the government to be able to undertake what we were doing, so those groups were fully involved in what we were doing. And in terms of how that impacted engaging with the children themselves, I think we really put the emphasis on explaining what we were doing and how we were going to use the results, and being very clear that we weren't passing any information on to any other agency, certainly not on to the police or anything like that, and that all information given was going to remain anonymous. We were very clear about gaining children's consent to participate and explaining fully what we were about. We had some situations where children didn't want to participate, but it wasn't very many. We had some adults within the community, such as leaders within the markets or others who kind of were overseeing the work that the children were doing, who were quite hesitant and didn't want the children who were around them to participate. But in some of those situations, we were able to talk to the adults again and explain what we were doing, and I'm able therefore to interview the children, and sometimes we just had to walk away, and we noted down the children that we had seen as observed children in those cases.
Great, thank you very much. I have one more methodology question. The question is, why specifically was the capture-recapture methodology selected? And were there other options for other ways to sort of find the sample, including things like respondent-driven sampling or snowball sampling?
Mm-hmm. Mm-hmm. Yes. So I think those two, the capture-recapture and the respondent-driven sampling, are the two that have been most used with children on the streets. We felt that the capture-recapture was sufficient and was what we could manage with the resources that we had. We were particularly keen to find a methodology that provided some measure of validity, and that wasn't just an attempt to count every child that we saw, because that only ever allows you to know that that was how many children you happened to encounter during that day, even with the best will in the world and of knowing where the children would be. Trying to just count the children that you find only ever generates the number that you found, whereas the capture-recapture enabled us to do a very similar thing of going out onto the streets and trying to find the children and being able to engage with the children, but by doing the two counts and comparing them allowed us to have that measure to understand how complete the initial count was, and to therefore be able to give an estimate of the total population, including the ones that potentially hadn't been interviewed. But I think some other studies have used the respondent-driven sampling in combination with the capture-recapture. So instead of doing two street counts like we did, they would do one street count, and the second count would be respondent-driven sampling, where you invite a sample of children back and then they bring in waves other friends to come and be interviewed as well. So it's possible to do combinations with capture-recapture. It's also possible to use administrative records as your second count. So if it was felt that there were reasonable records that already existed that were independent from the count that you were doing the first time and allowed sufficient coverage of the area, that would be another way to do your second count. We didn't feel that that was possible in Malawi, because the children that come into contact with the services could potentially only be a subset of the whole population, those that were willing and motivated and wanted to come and participate in activities, and that wouldn't necessarily cover the whole group. But I think we're seeing through the studies that now exist, the 4 or 5 studies that now exist of doing capture-recapture with street children, that it is a viable methodology, and one that is quite doable. It's manageable to do, even for smaller organisations who are interested in the location where they are.
Great, thank you very much. I have another question coming in. You mentioned in the methods that the databases were cleaned for duplicates. So someone is asking for a bit of clarification. How did they clean the database for duplicates? And were unique identifiers collected during the interview? And then if so, did that complicate the data collection?
Yeah, great question. So the whole basis of capture-recapture requires that you're able to match one count with the second count, and then therefore you need a certain amount of identifying information about each child to be able to do that count. So we asked children to provide us with their names and any nicknames that they were known by. We recorded gender, we asked for their age and date of birth, their home location, so we had about 12 pieces of identifying information that we were then using to do our match with. We used the R software and the matching element within that to run the matches. This is where I very much handed over to David Whitford, our statistician, to help us with that. So yes, so the R software then generates a kind of a percentage match, and we then had to manually go through the highest matches of those and decide which ones we felt were matches, genuine matches, and which ones weren't. So that was the matching of the counts. But you were also asking about the duplicates. So we removed duplicates from within each count. So for count 1, we looked for duplicates, and there were some children that had been interviewed twice or sometimes 3 times, sometimes by people within the same team. So these were very keen children who obviously enjoyed being interviewed. But there was only 12 of those in total that were duplicated within a count, and then we matched count with count to get the overall estimate using the matching program within the R software.
Great, thank you. And there are 2 follow-up methodology questions, I believe, from your answers. So the first is just asking for a bit of clarification. Did you mention that the enumerators found that children would bring their friends and there was some element of respondent-driven sampling happening? And the second is, how did you match up children that were observed but not interviewed?
Okay. So the bringing of friends was more more about kids saying, being with a group of friends and saying, oh, I've done the interview, now you come and do it. But kids who were already there, who we had already observed, who were kind of in the area where we were, rather than them going away and coming back with them at a separate time, which is more how the respondent-driven sampling is undertaken. And also signposting us to places where we might find other children. So although we had clearly outlined the areas that we were going to do our count within, sometimes even within those areas, so perhaps we had outlined one of the market areas, and they would then be able to, within the market, say, oh, you know, if you go this way, go that way, then you'll find some more of our friends who are around there. Yeah, so not quite as systematic as respondent-driven sampling, more just kind of within that locality. Children who were observed, when we came to do the matching between the counts, there were some records that didn't have enough information for us to be able to include in that matching process, but those records, if they were deemed to be a street child, they were still included when we did the analysis of the kind of the breakdown of the characteristics. So they would have been included for like the gender counts and that kind of thing, for any information that was observed about that child.
Great, thank you very much. There are 7 or 8 more questions that are coming in if you are ready for them.
Great.
So one question, why did you use a definition of children living and or working on the street full-time in comparison to UNHCR's broader definition of children with street connections? How did you establish that they were on the street full-time? You know, for example, observing them working, are they full-time? And then was there an assessment of whether the family was also living on the street or if the children were separated from their family? And I know some of your results encompassed a bit of that.
Mm-hmm. Okay, we decided to use children living and working on the streets because that is the term that is used in Malawi. That's the term that the government has used in their strategy, and it's very much the term that was used throughout all of the previous studies that had been done. So we wanted, because we were after results being useful in Malawi, we wanted to go with what was current and useful to the practitioners and the policymakers in Malawi. The street connections idea is, even if you went with something a bit more like street connections, you would have to break that down further to make it usable when you're doing the counts on the streets. So you would still have to say what a street connection looks like. So for us, we would take our street connections, if you like, were whether the child was sleeping on the streets or if they were doing work on the streets. So yeah, we were trying to tie in with what was being used locally, and the way that we decided whether or not a child fell in that category. We had a question in our interview form that was the enumerator's observation of what that child was doing. So that was an observed, were they observed working, were they observed to be sleeping or getting ready to sleep, or obviously having the wherewithal to sleep on the streets. And then we asked the children directly, where do you sleep? And for those that answered either on the streets or on the verandas or in the market or anything that was kind of an informal public place, they were, if they told us that that's where they were sleeping, they were counted within that category of children who live on the streets. Whereas if a child told us that they slept at home with their parents, with their relatives, with somebody else, and told us that they worked on the streets, then they were counted as a working child.
Great. Thank you very much.
Yeah.
So these three questions sort of fall a bit into a similar category. So I will give you the three together. The first is, with regards to the origin of the targeted population, did you find some children from other countries, or were they all from Malawi? The second is, did you look at the push factors in both cities, sort of driving children to the street, and if so, what were those factors? And then the third is, were you able to collect information on the mobility of children, such as the city or district of origin or places that they usually go, things like that?
Great. Thanks. Okay, so maybe I'll take the first and the third question together about the children's origins and their mobility. We didn't find any children who came from outside Malawi. We did find children from all over, pretty much all over Malawi, less so from the north, but definitely all over central and southern Malawi. I'm just trying to find the exact percentages. So yeah, it was way over 80% of the kids came from within Lilongwe or Blantyre and the district that city is in. Very few from outside, from further afield. And we had a lot of debate about how to ask this question, because what we wanted to know was not where their ancestral home is, but where the family are that they connect with or that they had come out from. So after the first day, we realized that there was, if you just said, where do you come from, where is your family, that it could mean a lot of different things. So we tried to be quite specific about asking the children, where is your family, where are your parents, or the people that you live with, or the people who care for you, and trying to find that bit of information. So even though we had quite a range of ethnicities of children from different tribes, from different parts of Malawi, their families were residing in and around the cities. So in terms of mobility, very few of them were coming any great distance. Most of them were very close by. We did ask them about how often they come to the streets and how often they visit their parents, and there obviously is a certain amount of mobility there. So about 60% of the kids are on the streets every day, but over 30% are only coming maybe once in the month, once in a week. It's quite a fluid thing for them. And we asked them about how long they had been on the streets, and there was quite a variation there as well. So how long had they been working or living on the streets? And there were about a third who had been doing it for less than 6 months, another third who had been doing that between 6 months and 2 years, and close to 30% that had been there for more than 2 years. And obviously the kids who lived on the streets, they had been doing it for the longest. There seemed to be a sense that working children, eventually it tapered off and they were less engaged on the streets, but for kids who were living on the streets, it was almost as if they were stuck there, and then that was it. They aged on the street rather than finding a way out.
Great, thank you very much. So I have a question that perhaps will actually go for all three presenters. So there's a question surrounding work and child labor. I will read this full question. Work is obviously largely important to many children and their families. Some of the children in the study were working, returning home, and still attending school. This seems like a successful juggling of priorities given the circumstances. A question, therefore, might be how to measure what is considered a negative work or negative relationship to the street. Perhaps not all work on the street is automatically considered negative. So what is Retrack's perspective on this, and Chisomo, and also the government? And what kind of child labor on the street are, the three different parties most concerned about? With a follow-up that they appreciate this is a very large question.
Excellent. I might hand that over to Charles and Mr. McKnight to handle first.
Oh, did we lose Charles?
Are they there? Well, let me start. Maybe they'll join us. This was a very interesting issue for us from Retrack's perspective. A lot of our work to date has been with children who are living on the streets, and our focus has been more on helping children find ways back into families, where it was very clear from the results here that we weren't dealing with children who were completely separated from their family, and that whilst reintegration was needed for some, the focus needed to be on addressing child labour and child work. I spent a while trying to figure out how I could connect the types of work that children were telling us about with the different definitions of work and labour, and because for most of these children it does interfere in some ways with their studies, with their education, and because of the being done in a public, unregulated place, it is all considered child labour, really. But as you have quite rightly seen, there is this combination of work and school and family life. And when I was looking for examples of how Malawi was dealing with these issues, what I found was that because a lot of the emphasis on child labour in Malawi was driven by the tobacco industry, and so it's got a very rural focus to it. And then there is some work going on around child domestic workers, so largely the girls that are working in other people's families. But there wasn't much going on around this very informal urban type of work. But I think probably learning from some of the domestic work and the agricultural work, there is a need to recognise that this work is necessary for some of these families, and that we need to find a way to enable children to be working safely within their families, but also making sure that we are strengthening those families so that the necessity for child labour reduces. So I definitely think there is a balancing act to do there, and Malawi has a very clear policy on child work and child labour that balances that very well. And I think there is a need to take these lessons from the rural and domestic sphere and apply it to the street work that's happening. Charles, you're back.
Yeah, I wanted to say the director has something to say on that.
Great.
Well, actually, what I really wanted to comment on has been ably commented on by Joanna. What we are seeing is whatever is happening in terms of child labor, which has a focus on the tobacco industry, needs to be applied to the urban setting, and the enumeration study is a useful window for us to look at what can be done for the urban setting in terms of balancing the act between what one would say is child work and what one could also term child labor, including the worst forms of child labor. And that's why we are saying, moving forward, there is need for further research to look at what is really happening, more especially with the children who are seen working, enforcing compliance with our list of hazardous activities for children. We see how things are turning out with the children that are living and working in the streets.
But going forward, Lily, the issue of strengthening the capacity of families and communities would be very ideal, because that, in the long run, will enable them to take care of their young ones. So in terms of programming, that would be a key ingredient, probably while we are looking at the legal aspect of it. But if the families and the communities, just as Joe said, in terms of legislation, I think we have all what is required to define all those aspects. But sometimes it's in the way we've rolled out or share those legal documents to the rural masses. But in the long run, if the families and communities, mainly in the peri-urban, are strengthened, their capacities enhanced, we believe they'll be able to take care of their young ones and probably block the whole issue where there is they're involved in child labor or... Thanks.
Thank you very much. I have a couple questions and comments that have been submitted regarding children involved in sex work. So one attendee has said, I'd like to seek further clarification on what was meant by increasing support for children involved in sex work. What kind of support is being looked at? And does this include removing them from this situation and facilitating reintegration with families or perhaps social support? Are there any recommendations for advocacy and policies? And as Malawi is now planning for the Malawi Growth and Development Strategy 3, is there a chance of ensuring that this issue is included via urban planning or the like?
Charles, would you like to go ahead?
Thanks a lot for that question. Let me come in before Charles comments. Yes, this is an area that requires a lot of attention in terms of children that are involved in the sex work. Already, as part of our rehabilitation program, working with the children that we have removed from the streets, we are also looking at that aspect. And as we are planning for the Malawi Growth and Development Strategy 3, actually this is one of the issues that we need to tackle through the window of reducing violence against the children. And we have to look at what is it that we need to provide over and above the current services that are, for example, being provided through what are called one-stop centers and other rehabilitation programs that we are providing to such children when they are part of the rehabilitation program. So indeed, it is necessary that these are attended to, because when you look at the population of 1 to 5 being girls in the streets, that's quite high, and it raises some concerns in terms of the safety of those 20% of the girls who are found either working or living on the streets. So from our study that we conducted on violence against children and young women 2 years ago, what we see is there is need for us to protect such children. So at the moment, we are in the process of working out a 5-year prevention campaign, and that's one vulnerable group that has to be targeted by that campaign.
And currently, we are Chisomo girls, and we're working with a local NGO, not very local, it is International Theatre for Change, and the approach has been specific capacities and desires of those girls. When we reach out to them and they're willing to embark on the path of transformation, we look at the specific capacities and desires, and more or less like we are in the first 4 months, I can say, but the approach is to make sure we involve the participants in a step-by-step through various professional and emotional challenges involved into entering in the world of work. And so we're doing this because we know in the past attempts have been made to empower or transmit some skills, but those skills probably could not meet the labor market needs. So we wouldn't really want to impart the same skills as these young girls, and they find themselves not needed in the market. So it's something that we've just started doing, and probably it'll be one of the areas we can also look as a research area as to how best we can. But I think currently what we felt like doing is to make sure we base whatever we are doing on persons' specific capacities and desires, and then take them step by step. And as I've said, we are just within the few months of this kind of approach. Thank you.
Thank you all very much for a very thoughtful and thorough answer to that. I have a few more questions I believe are mostly directed towards Joanna. So the first, were there any ambiguous circumstances that made it difficult to determine if a child was living on the street or a street living or a working child? For instance, were there circumstances where a child would not consider themselves a street living child, but by the definition that the research used, your research team would consider them that?
Okay. The way that we were implementing our definition was the children's responses to questions about where they sleep and where they work and our observation of it. We didn't ask them what they would consider or what they would call themselves, perhaps what category they would put themselves in. It was based on the answers to their questions. So yeah, I guess it's possible that the children might disagree with our findings. But it was important for the study to have a very clearly defined way of categorizing the children, and doing it through their responses to those questions and our observations of their activities was the easiest way to action that definition. We are, however, looking for a way to feed back the results to the children and to get their input on our findings. We were really keen to hear from the children themselves, and because this was quite a quantitative study, I realised I didn't answer the question about push factors earlier, which we didn't cover because it had already been covered in the qualitative studies that preceded ours, and we were just after a number here, so that it hasn't been as participatory perhaps as other things that we've undertaken, other ways that we would do our studies. So we're hoping to be able to feed back the information and give children a platform to kind of respond to that, and to be able to pass that on to people who are working with them, because we do think it's important to have the children's voice involved.
Great, thank you very much. One more technical question. What is the margin of error for your estimates for the counts of children?
Okay. We are not giving a margin of error for this study because it isn't technically a survey in a way that you can do that. The methodology itself provides for that kind of recalculation. The nature of the capture recapture is itself an adjustment of the initial count, and so it doesn't have that kind of it doesn't allow for you to do it in the same way that you could with a survey. And this is where I really wish I could hand over to David to answer that question, because I do not have all the technical know-how to fully answer that. So if you are interested in more information around that, please do follow up with an email, and I'd be able to connect you with somebody who knows much more about it.
Great, fantastic. And I will, in a follow-up email after this webinar, I will share all contact information for our presenters. Great. So follow-up will be facilitated. I have one more question and then one more request from a participant to share some information. So the first question is, are you planning for conducting this research in additional countries?
Yes, we would very much like to be able to do this in other countries. We're looking at opportunities to do a similar thing in countries where Retrack is working directly ourselves or through other partners. We're very aware, however, that we we definitely chose the right place to do this initially because of the size of Lilongwe and Blantyre and the nature of those cities. It was a reasonably easy place to undertake these. Some of the other places where Retrack is working, for instance Nairobi where I'm based, or Kampala and Addis Ababa, are much bigger cities with much more complex networks and things going on in those cities, and we're very aware that doing this somewhere else is a very different ball game, and it would have to be adjusted to fit those locations, but it has been used in bigger cities, in Accra, in Cairo, in places like that. So it is possible to do it in larger cities, and the mapping and things would need to be done carefully. And I had a conversation with a colleague who's working in Latin America, talking about Guatemala City and the gangs and the guns that are rife there, and thought, that wasn't an issue that we had to face or even think about in Malawi. So it would definitely need careful planning for different locations and for the circumstances of those cities.
Great.
Yeah.
Thank you very much. And then just a request to share from an attendee for participants who are interested in furthering this conversation. So in writing in from the Consortium for Street Children, first of all, thank you very much for such a great presentation. And they just would like to bring two things to everyone's attention. The first is that the consortium recently finalized a briefing paper on counting and enumeration, which actually addressed the topic of counting, and it discusses different methodologies and will be available in the next few weeks. So audience members may be interested to follow that. And the second is that if there are any consortium on Street Children members out there that would like to continue this discussion, to please get in touch with Natalie. And her email is natalie@streetchildren.org.uk to continue the conversation. With that, that concludes all the questions that have come in. So I'd just like to offer an opportunity if Joanna or Charles or Mr. McKnight would like to add anything as a final note to this presentation.
Maybe just following up on that last comment, I think as Retrack we're really keen to continue the conversation. We're definitely going to be working with Natalie and the consortium to look for opportunities to do that, but we'd really welcome people to reach out to us and share their experiences, and so that we are able to continue this conversation, because there are still only a limited number of studies that have been done in these kind of ways. So very keen to talk to people who are interested in doing a similar thing.
And from Chisomo, we really have found this exercise very helpful, and I think we now know that if we are to bring in positive long-term change to the children, then we have to begin to look at several aspects like individualized attention, tailor-made services, children participation, inclusion, involvement of families and communities, lobbying and advocacy. And I think the head count itself enables all these things, and would encourage other participants to look at all these aspects when they're looking at issues of street-connected children.
From the government side, when the results of the enumeration study were being disseminated, unfortunately, we did not have all the key stakeholders that we should have had. So we would like to continue with the dialogue, and we hope that as we continue, some of the questions that were being addressed in this conversation would also need to be, what is critical is for our role to lead and coordinate in terms of the effort to deal with issues of children who are living and working on the streets of Malawi cities. We would like to start with Blantyre, Lilongwe, and 2 other cities. But since we only have results for 2, we can use those results as a launch pad for engaging with partners in the and the funds permitting. Thank you.
Thank you very much. So just again, a huge thank you to Joanna and Charles and to Mr. McKnight. As I mentioned at the beginning, this webinar has been recorded and it will be posted on the CPC Learning Network website, which is www.cpcnetwork.org, where you can also find, a whole series of other webinars on topics around child protection research. There will also be a follow-up email sent sharing the presentation and contact information. So please follow up with me or with our presenters to continue the conversation. Have a fantastic day. Thank you.